New study of 125 countries finds no evidence that the COVID vaccines provided any benefit. Joseph Hickey, PhD, co-author of a global study of excess deaths during the COVID-19 pandemic, joined the Defender in depth this week to discuss the study's findings and analyse the likely causes contributing to the increase in excess deaths and overall mortality. A new study by a team of Canadian researchers into excess mortality during the COVID-19 pandemic found that patterns of excess death globally could not be explained by the virus, including long COVID. And by the way, all of the references to everything we're reading today are linked there on the Vigilant News Network article, so you can go and look at it for yourself. We encourage everyone to do so. The study, by researchers with correlation research in the public interest, examined excess mortality in 125 countries during the pandemic. It found that mortality patterns correlate closely with the imposition of restrictions such as lockdowns and with the COVID-19 injection rollout. The investigation determined that pandemic-related restrictions resulted in 30 million deaths globally and that 17 million deaths can be attributed to the COVID-19 injections. The researchers concluded that nothing special would have occurred in terms of mortality had a pandemic not been declared and the declaration had not been acted upon. Hickey explained that all-cause mortality refers to the number of deaths without filtering by the cause of death during a given period, while excess deaths refers to how many deaths occurred that are above and beyond what would have been predicted for a certain period. Hickey and the study's co-authors analysed pre-pandemic raw data from 2015 to 2019 and data collected between 2020 and 2023. Hickey said the data, collected from 125 countries, found a large amount of excess deaths. We calculate that over the COVID period, about 0.39 of the global population died in excess. That compares to about 0.97 during the 1918 Spanish flu pandemic. Hickey said this was the largest non-war mortality event in 100 years globally. The study also found patterns of excess mortality across the world were very heterogeneous, as they varied significantly from country to country, across regions within the same country, and across age groups. Hickey said there are some countries that immediately following the declaration of the pandemic in March of 2020 had an enormous spike in excess mortality that is very sharp, very fast, and very narrow. But that does not occur in all countries. There are neighbouring countries that don't have that at all. There are countries that do not have any excess mortality throughout all of 2020, and it's only in 2021, when the injections are rolled out, that they suddenly have excess. And that excess can be a sharp spike, or it can be a raised and sustained plateau. Noting that none of the countries had any excess death before the declaration of the pandemic, Hickey said this finding does not match the spread of a deadly virus. If you take the model of a new, very deadly pathogen that is spreading around the world, you should not see this very high degree of heterogeneity. It's simply not compatible with the hypothesis of a particularly virulent special pathogen, he said. If there was a specifically virulent and dangerous pathogen that was spreading around the world, it would not wait for a political declaration of a pandemic to start causing excess mortality. Instead, a much simpler, much more elegant explanation is that it's the differences in national policies, national measures of one kind or another, that are responsible for these very different outcomes in excess mortality, Hickey said. Hickey also notes the biological stress caused by political measures being the big cause of deaths. He says, over the whole COVID period, there's more excess mortality in that adjusted P-score measure where there's more poverty, meaning that the analysis found that the main correlation between excess mortality and a socioeconomic variable is with poverty. He says it's really more frail populations that would be more affected by things like shutting down the economy, the informal economy, having measures that restrict people to remain in their residences. Obviously, that has a much larger impact on poorer people than richer people in terms of their lifestyle, their ability to do exercise, receive goods by delivery, and so on. And he says that such measures helped cause biological stress, which disproportionately hurt the poorer strata of society in most countries. He also said that treatments such as hospitals placing mildly sick people on ventilators and the associated medications that are used with those, the very significant stress caused by curfews and removing opportunities for work and leaving one's home created a large amount of stress that is medically very significant. Hickey said his team's study also identified the COVID-19 injections as a significant contributor to excess deaths. Quote, the vaccine rollouts involve a direct injection of a product into your body that can be toxic, Hickey said, noting that this may be due to several potential factors. And you can see some of those there, including some clearly toxic components, and also the question around whether it's due to the actual injection product and how it interacts with the body, or due to something more simple like the toxic components. Hickey said that the injection-related impacts may also have affected unvaccinated people and may have interacted with pandemic-related restrictions. Quote, it's also possible that if vaccines have an immune-suppressing effect, people who get vaccinated are then more likely to get infected with run-of-the-mill pathogens or omnipresent pathogens, Hickey said. Once they're infected, they could then infect unvaccinated people who also might be subject to some immunosuppression based on the measures and the stress that accompanies the vaccine rollouts. Peaks in excess deaths across countries studied correlate very closely with peaks in vaccination in those same countries, Hickey said. Australia is a really striking example where in January of 2022, which is the summer in Australia when there's normally a trough in all-cause mortality, at exactly that time, there was a booster rollout, the first booster, and there is a very abnormal peak in mortality at the exact same time. His analysis also found that no apparent benefit of the COVID-19 injections, noting that the countries that were most injected had the highest injection uptake, end up having persistent excess mortality into 2023. He says at the end of the day, excess mortality is caused by political interventions, by public health measures that should not have been applied. And that includes the injection rollouts, because there is very clearly no evidence that the injections prevented excess deaths or caused any benefit. Hickey said correlation is working on more great, interesting research, including a comprehensive study of what happened in the spring of 2020 in subnational jurisdictions, noting that his team has already identified some very interesting results with that. We look forward to more of what they're going to find. And Hickey says we're not funded by any governments or any corporations. Any funding we get is from individual donations, and all we can do is try to seek the truth. We're doing the best that we can to illuminate as much as we can, and we're grateful for them. Again, you can watch that full broadcast there, linked on the Vigilant News Network, and we encourage everyone to go back, look at the links included, the source documents, and share them widely. Everybody's talking about those weight loss injections because the results are so dramatic. They work by lowering blood sugar and reducing appetite. But what if you need to lose weight, but you don't have the money and don't like weekly shots? Well, that's why doctors created a weight loss supplement called Lean, and the results are remarkable. The studied ingredients in Lean have been shown to lower your blood sugar, burn fat by converting it into energy, and curb your appetite and cravings so you're not as hungry. But listen, Lean is not for the casual dieter with only a few pounds to lose. The doctors at Brickhouse Nutrition created Lean for frustrated dieters with 10 or more pounds to lose. Let's get you started with 15% off and free rush shipping so you can add Lean to your healthy diet and exercise plan. Visit leanvnn.com and enter promo code VNN for your 15% discount. That's promo code VNN at leanvnn.com.
Dr. Denis Rancourt, Dr. Marine Baudin, and Dr. Jeremy Mercier, they have written a stunning paper that the world should know about that says that the COVID-19 mRNA genetic injections have killed
17 million people. Yeah.
Absolutely stunning. Can you please tell us more about the paper?
That's the global number. We studied many countries in Latin America and in the equatorial region, so we have a representative sample of the world, we believe. So the number we extract from our analysis allows us, we calculate the toxicity of the vaccine for all ages, and the number allows us, given the number of doses that have been given worldwide, to conclude that 17 million people would have been killed by this vaccine.
And what I would like to add, it's that the data we're working with is all-cause mortality, so it's nothing related to COVID mortality or anything else. It's like you just count death, so it's 0 or 1. There is no bias in attributing any cause or something. Yeah. And it is a data that you can have by function of time, so it could be by day, by week, by month, by a function of characteristic of the individuals, like the sex, the age, and other characteristics, and by jurisdictions as well, so it's very powerful.
But and having it by time, like by week or by month, and by age group, means that you can actually see when there's a rollout of a booster, for example, which happens very quickly in time for a given age group, you can actually see immediately following it a maximum in the all-cause mortality. So an excess mortality actual peak that's temporally associated with that rollout. And we see that repeatedly for each rollout.
Consistently across all countries.
All the countries that have sufficient data where you're able to look at it and you have both the vaccine data and the mortality data, this is what we see. And we can quantify it, therefore. And so we can quantify the toxicity of the vaccine, your risk of dying per injection.
And what's really interesting with, it's not cherry picking, choosing those countries. It's very important to understand that when you look at all-cause mortality, you see that deaths are increasing in the winter and decreasing in the summer. And it's the opposite in the southern hemisphere. Their summer is our winter. So in the summer, you should have low death. But during the COVID vaccine campaign, suddenly you see spikes in mortality right after vaccine campaigns. And it's very clear because it's in the summer where you should see a low death period. So it's incredible to see such a dramatic correlation between vaccination campaigns and spike death.
Yeah.
で組織が来たということです。だからそういうことを今はもう研究を開始します。基本的に。これはいろんな先生方と連携を取った上で開始します。それが1点です。だからメカニズムとして病理細胞学的なプロセスとして何が起きているかについては後からです。今後起きた人についてももうすでに病理学会や総医学会は声明出してます去年の4月ぐらいに細胞をきちっとしましょうということで声明出します。だから今後はですね、被害を受けた患者さんに対してどのような医療をしないといけないかを我々はそれについてのガイドラインを早期に作る必要、診断技術も開発する必要がある、そういうところに来てますから、それはやります。もう一つは亡くなった方ですでに病理解剖して、それでも評価不能になっているということをずっと押し通すのであれば、それはまた弁護士さんと相談して訴訟ということになります。もうちゃんと予防接種に基づいて被害者救済をしてくださいということになります。もうこれはもう日本は幸いそういうことがきちっと法律で定められている。新たに今法律を作らないといけないというわけです。だからそういうことについて我々医科学者として責任のある行動を一つ一つ取っていくということです。
もう一点よろしいですか。今回その論説にですね、全医療関係者の警告と要請というのは強いような内容が書かれていますけれども、例えばその医療学会ですね、全国の医療学会で心筋炎だったり帯状疱疹以外にもですね、さまざまな症状の症例報告があって、全国でその医療学会で300以上のその報告が今されているというのは、私は異常な状態だと思うんですね。この医療関係者に向けてですね、先生が伝えたいことってどういうことですか。
もうはっきりしているのは、医療関係者のみでなくてですね、厚労省はワクチンを打った人に全員ですね、ワクチン接種手帳なるものを配布している。原爆のね、被爆者手帳と同じようなものですよ。配った上で、ちゃんとそれをフォローするように医療機関に周知して、ワクチンとの関連性のあるかないか、あると疑われたらバイオプシーして検査する。これをやるべきだ。